next one, the second one, have they joined? Is abstract not yet? Okay, then we will move on to the fourth one, abstract number 6.
So our next presentation is abstract ID number 6, knowledge, attitudes and practices on tobacco and alcohol usage among estate communities in Nuwara and Badulla districts in Sri Lanka. Authors are Dedulla Pitiya WSK, Vaninayaka R.A., Ranganathi, Kirthisinghe DSV and Budwai KG from National Authority on Tobacco and Alcohol.
Have a good day for all of you. Sorry for the inconvenience you have faced during technical issues. And I'm Salamini Dedulla Pitiya, the research officer from the National Authority on Tobacco and Alcohol. Today I'm going to present one of the studies we have completed in this year under the topic of knowledge, attitude and practices on tobacco and alcohol usage among tea estate communities in Nuwara and Badulla districts in Sri Lanka. Under the study background, as you all know, more than 70% of deaths all around the world are happening due to non-communicable diseases. And the special thing is tobacco consumption and alcohol consumption are the major determinants under NCDs. So overall, 7 million deaths are resulted all around the world because of direct tobacco use, and approximately 3 million of people are dying all around the world in a year because of excessive consumption of alcohol. And underdeveloped and developing countries are more vulnerable to NCDs. And in Sri Lankan context, the Ministry of Health in Sri Lanka has a big concern on estate population since the most of them are disadvantaged communities. And the regarding the statement of research problem, the few studies have been systematically evaluated regarding the practices, knowledge and attitudes regarding these substances usage in these kind of communities. Addressing these research gaps is essential for the developing tailored, culturally relevant prevention and education programs to reduce substances use and its negative health and social impacts for these type of communities. And the general objective of the research is to assess the knowledge, attitude and practices related to tobacco and alcohol usage among estate communities in Nuwara and Badulla district in Sri Lanka. And the SPIC's objectives are listed as in the slide. I'm not going to mention one by one because of the time limitation here. And this is the literature review we have done under the study. By concerning the methodology of the research, we have done a descriptive and cross-sectional study, and we have used quantitative approach for the study, and the study population was the tea estate sector residents aged 15 and above in Nuwara and Badulla districts in Sri Lanka. And the purpose of sampling was done as a sampling method, and we calculate the sample size as 450 individuals, but we got positive responses from 409 participants from those 2 districts, and the interview administrative questionnaire was used as a primary data collection instrument here. When I am disseminating the main findings of the study, the majority of the population, majority of the participants has been belong to 51 to 50 years of age group, and the majority of the participants were females, and the majority of the participants were Tamils in those areas, and a significant majority of the participants, approximately 93% of the participants were estate sector workers. And the majority of the participants had no proper education, approximately nearly about 53% of the participants. The majority of the participants has married on that sample. And the most of the respondents, nearly 71% of the participants are employed in private sectors, and most of the respondents had earned less than 20,000 per month. And nearly 40% of the participants earning between 20k to 50k rupees per month on these areas. And regarding the practices related to smokeless tobacco, smoking tobacco and alcohol, nearly 62% of the participants have used smokeless tobacco at least one time in their lifetime. And only 31% of the participants have reported using alcohol here. And nearly 18% of the participants are currently using smokeless tobacco here. And nearly 47% of the participants have tried alcohol at least one time in their lifetime. Among smokeless tobacco users, among those users, nearly 43% of the participants use betel nut with tobacco. And the majority of the smokeless tobacco users are using betel nut without tobacco, and the majority of the smokeless tobacco users are using it at work, and the majority of the smokeless tobacco are using daily. And the majority of the smoking tobacco, I mean cigarette smoking tobacco users, majority of them are using smoking tobacco more than 3 times a day. And majority of the smoking tobacco users are reporting using cigarettes, and among them the majority of the smoking tobacco users are smoking every day, and the most common age group for starting smoking tobacco is among these communities is 16 to 21 years old age group. And among the alcohol users in those communities, nearly 40% of the participants had used beer, while 37% of the participants have consuming other beverages like wine, moonshine, likewise. The Arab was used among 21% of the users. Among the users were nearly 48% of alcohol using alcohol occasionally, and the majority of the alcohol users are initiated their alcohol usage during 31 to 40 years age group. And you can see here some trends between consumption versus gender. In here, the majority of the smokeless tobacco users used at least one time per their lifetime majority was females, and the current usage, majority of the current users of smokeless tobacco also were the female. And among males, the smoking tobacco usage was higher than females. And same scenario for alcohol usage. The alcohol usage of among men, the alcohol usage were higher than female. When we considering the type of alcohol they are using, the females are mostly using beer and wine there, and males are mostly using arak and beer there. Among females, the beer nut without tobacco was most common, and among male, the beer nut with tobacco was common. And regarding the knowledge regarding the smokeless tobacco, the majority of the participants did not aware about the laws and regulation related to sales of smokeless tobacco, and the knowledge regarding the health effects of smokeless tobacco was considerably high in those communities. The attitudes towards smokeless tobacco is negative among the state communities because the majority of the population are thinking that smokeless tobacco are less harmful than cigarettes, and the smokeless tobacco are addictive like cigarettes, and majority of them are believing that they will get any health concern by using smokeless tobacco daily. And these are some trends. I'm not going to explain because of the time limitations. And it appears as the majority of the participants in these areas are aware about that harmful health effects of alcohol and smoking tobacco usage, but they didn't aware about the sexual impotence caused by tobacco, and the majority of the world's mortality has been done because of tobacco. Furthermore, the participants did not aware about the commercial influences towards tobacco and alcohol usage. The majority of the alcohol and smokeless tobacco users in these areas using smokeless tobacco and consuming alcohol because they think that it relieves their stress and it gives their fun likewise, and also they think that they should use those substances because their friends are using those. The same scenario for alcohol users. They are thinking that they should use alcohol because their friends are using those substances, and they believe that it gives fun for them and relieves their stress and anxiety likewise. And these are the main findings. I have already explained about those findings as well. These are the main recommendations we have recommended through the study's findings. The main recommendation is awareness campaigns. We recommend some of the strengthened awareness about existing laws related to sales and consumption of smokeless tobacco and alcohol throughout the workshops and public messaging, and also awareness campaigns about commercial influences towards tobacco and alcohol usage, and community interventions also recommended here, and policy and regulations towards beer also recommended here. Behavior changing strategies, targeted interventions, and continuing monitoring and research also recommended here. These are the references we have used for this study, and this is the end of my presentation. Thank you so much for hearing my presentation patiently. Thank you so much.
Now the floor is open for questions.
I have a question. The sample was selected from the same area?
No, from Nuwara district and Badulla districts, because the majority of the population of tea estate communities are belonging to those areas. That's why I selected those two districts.
Thank you. Okay, another one. Okay, thank you so much for your informative presentation and good research. So my questions based on that. Your recommendation, among your recommendation, you have actually mentioned that the universal prevention initiatives to do something in that areas, actually policy decision as well as basic awareness and universal prevention measures. However, some are actually, while examining your presentation, I can understand some are wanted to selective or even sometimes indicated prevention measures. So actually, what kind of things you are suggested that the person who substance use disorder, actually not the substance use disorder, alcohol use disorder as well as some other chronic tobacco consumptions, people to what are the recommendations you are suggested to actually selective level and in an indicated level.
Thank you for the question. Actually, in these recommendations, we have suggested some interventions like interventions, such like health promotion interventions towards reducing the usage of tobacco and alcohol addictions among those communities. Likewise, the actual treatments for those addictive persons should be progress under the Ministry of Health at the clinical level. Those suggestions should be comes under the Ministry of Health clinical authorities actually.
For the interest of time, we'll move on to the next presentation.
Thank you so much, ma'am.